What is the most serious skull fracture? Basilar skull fracture. What is the most common symptom of pinworms? Anal itching. What is the most common congenital anomaly of the GI tract? Meckel's diverticulum. What is the most common manifestation of Meckel's diverticulum? Painless rectal bleeding. What is the most common type of hereditary nephritis? Alport syndrome. What is the most common cause of neonatal seizure? Hypoxic ischemic encephalopathy. What is the most important nursing consideration for infants with eczema? Prevention of secondary infections. What is a positive Ortolani sign? An audible click on hip manipulation. What is the most serious anomaly associated with Down syndrome? Congenital heart disease. What is the most common bacterial infection among infants and children? Otitis media. What is the most accurate method to evaluate the effectiveness of diet and insulin therapy over time? Glycosylated hemoglobin test. In a newborn that is small for gestational age, what is the most common metabolic complication? Hypoglycemia. What is the most common parasitic infections of children in temperate zones? Enterobiasis. What is the most common anomaly of the eyelid? Ptosis. What is the most common cause of acquired hypothyroidism? Thyroiditis, inflammation of the thyroid gland. What is the most common cause of shock in children? Acute hypovolemia. What is the most common anemia of infancy and childhood? Iron deficiency anemia. What is the first sign of acquired aplastic anemia? Hemorrhage secondary to thrombocytopenia. What is the most common thrombocytopenic purpura in children? Idiopathic thrombocytopenic purpura. What is the most common inherited bleeding tendency? Von Willebrand's disease. What is the most common childhood cancer? Leukemia. What is the most common site of relapse in children with leukemia? The bone marrow. What is the most common presenting symptom in children with Hodgkin's disease? Localized cervical or clavicular adenopathy. What is the most common solid tumors in childhood? Brain tumors. What is the most common cause of preterm seizures? Intraventricular hemorrhage. What is the most common drug poisoning in the United States? Aspirin overdose. What is the most common cause of death from poisoning in childhood? Iron poisoning.